Okay, so chapter 22 is about the digestive system. So the digestive system is this system that is located between the mouth and the anus. It is having several organs that are accessory organs and some that are part of the digestive tract. And most of these organs, although they are located in the abdominal pelvic cavity, some of them they can be located in the thoracic cavity, like in the case of the esophagus. And as well, we have some in the head, like the oral cavity. So the digestive system is subdivided into the alimentary canal, which is also known as gastrointestinal or digestive tract. So in here we have organs that allow the passage of food continuously between the oral cavity and the intestines. And then from there, you have the connection of several accessory organs, like the liver, like the pancreas, salivary glands, that helps in the digestive process. So what includes in the alimentary or gastrointestinal tract? We have the oral cavity, which is the fancy name for the mouth. We have the pharynx, which is a shared tube between digestive system and respiratory system. Remember, the pharynx has three portions: nasopharynx, that is exclusive from respiratory system, oropharynx, and laryngopharynx, which is shared between digestive and respiratory system, where food and air goes by. And then we have the esophagus, which is a kind of long tube that is located in the thoracic cavity posterior to the trachea. Allows the passage of food from the oral cavity into the mouth. And internally, it is covered by the epithelium, which is stratified squamous epithelium without keratin. Do you remember why we have that type of epithelium in the esophagus? A stratified, several layers of squamous cells without keratin. Why do we have it?
Protection from raw
food. Protection from raw food as it's passing. Very good. And then we have the stomach, which is a sac that temporarily stores food that we ingested. And then small intestine is subdivided into three major portions. The one that is close by the stomach, which is the duodenum. The next one that is called the jejunum. And then the last, which is the ileum. D-J-I. Duodenum, jejunum, ileum. Those are the three parts of the small intestines from proximal to distal. And then we have the large intestine, which is subdivided into different segments. The first is very tiny, which is called the cecum. It has a little appendix there, which is the vermiform appendix, and then a part that goes up on the right side of our body that is called the ascending colon. And then the ascending colon turns from right to left, and it runs almost horizontally. That is called the transverse colon. And then the transverse colon turns down, and then it gives a descending part, which is the descending colon. And then the ascending colon makes an S-shaped turn that is called the sigmoid, and then the sigmoid ends in the rectum, and then we have the anus, which is the last part of the alimentary canal.
All chemists are accounted for.
And then part of the accessory organs is not only these glands like the liver and the pancreas, but also the gallbladder, which is under the liver. And then we have salivary glands and the teeth, which are accessory organs, and the tongue. So here's the overview of the digestive system. This is the alimentary canal, starting from the mouth up to the anus. So this is the oral cavity, esophagus, stomach, duodenum, jejunum, ileum, cecum, ascending colon, transverse colon, descending colon, sigmoid, rectum, and anus. Accessory glands, salivary glands, we have three major glands in pairs in the oral cavity. Parotid gland, this is a large gland over the masseter muscles here on the sides of the mandible. And then under our tongue on the sides, we have the submandibular gland, the one that produces more saliva. And just right medially and anteriorly under the tongue, we have the tiniest salivary glands, which are the lingual glands. And then on the right side, right upper quadrant of our body, just under the diaphragm, we have the largest gland in our body, that's the liver. It helps to detoxify our body from substances like drugs, alcohol, and also helps to process nutrients and make most of the proteins in our body, with the exception of the antibodies, which are made by the lymphocytes. But the rest of the proteins of our body are made by the liver. And then under the right lobe of the liver, which is this large lobe, we have the gallbladder. The gallbladder secretes bile that helps to emulsify the lipids, which is breaking down large molecules of lipids into smaller molecules. It's like a soapy solution. When you have a dinner, and in this dinner you have residues or a film of fatty food, if you make a solution with soap and then you put it on top of this plate with the greasy food film, you can see how the fats of this food dissipate sideways. So this is emulsification. That's what the bile does. Someone who has removal of this gallbladder, guys, they cannot eat lipid-rich foods anymore because they will appear in the stools, these fats. This is called steatorrhea. So that's the liver. And then we have here behind the stomach in the retroperitoneal space the pancreas. The pancreas produces three major hormones: insulin, glucagon, and somatostatin. They are in charge of increasing and decreasing blood glucose levels so that we can obtain energy with glucose. So functions of the digestive system: taking food, breaking it down, that's digestion, breaking down large molecules to smaller ones so that we can absorb these foods. We start digesting the time that we start putting things into our mouth. We start breaking it down mechanically and chemically. We will see this in a little bit more detail. Ingestion itself is the intake of food and water. Secretion, we have several glands that secretes substances. Like we have exocrine glands and endocrine glands, mixed glands in the digestive system. So part of the secretion will be mucus to coat this epithelium so that the food transfer really smoothly. We also have enzymes. The enzymes are the ones that chemically breaks the bonds between the nutrients that we ingest. And then we have acids that activate some enzymes, and as well they can break down molecules. Like the acids in our stomach can start breaking down the proteins. If you have prepared ceviche, which is basically sometimes raw shrimp or raw fish, you add a lot of acid from lime juice. That starts breaking down these proteins to make it a little bit softer. Okay? So acids can break down proteins. And then we have secretion of hormones like insulin, glucagon, somatostatin, and also some hormones that are released within the intestines. The wall of the intestine, they have some local hormones that helps to move these intestines. And then one of the processes of digestion is moving the food along the different segments of the digestive tract. This movement is propulsion. And this propulsion happens because you have contraction and relaxation of the muscles that surround the digestive tract. So these are rhythmic contractions of this alimentary canal, and this is known as typically peristaltic movements, which is contraction, relaxation. Then we have mechanical digestion, which is basically chopping down into smaller pieces of food. This starts by chewing with your teeth. And then you have chemical digestion. We have enzymes like amylase that is secreted by salivary glands. Amylase breaks down bonds between starch. A starch is made out of glucose molecules bound together. Potatoes, they are rich in starch. Corn is rich in starch. So we have this enzyme in the salivary glands that starts being secreted with saliva, and we start breaking down this starch. And then we also have lipase. Lipase breaks down lipids. Typically, fatty foods taste so good because we have lipases that breaks down these lipids, and then we start tasting them with our mouth. So we have salivary lipase and salivary amylase in our mouth. And then absorption is basically bringing the nutrients from the alimentary canal into the circulatory system. But first, it has to pass through the wall of the alimentary canal to go into the blood or the lymphatic vessels. Remember what are the lymphatic vessels that we have in our intestines? That you had trouble to find it in the model because in the model it doesn't show them. The lacteals. I heard it there and I saw it there like doing this. Another function is to eliminate what we don't need. This is defecation. So we absorb all the nutrients possible all the way down into the intestines, the small intestines, and then from there the food that we don't digest goes into the large intestine. And in the large intestine we start absorbing water if it's necessary, and then we produce also vitamins with the bacteria that we have in our large intestines, like vitamin K, certain types of vitamin B. But as we absorb water, that food that it was undigested, it becomes more solid. And then lastly, when we reach into the rectum and the anus, we eliminate it through the process of defecation. And the undigested food is going to be known as feces. In the abdominal cavity, these digestive system organs are protected by two membranes. And again, you will hear the name of visceral and parietal. We have visceral peritoneum, which is the closer to the cavity, and the outer peritoneum, which is going to be the parietal. So, the parietal peritoneum is a serosa. It's a serous membrane. And this one follows the organs, the abdominal organs, and in some cases helps them to have a transfer of certain blood vessels so that the blood vessels provide the blood supply to these organs, like in the case of the mesentery, which is the membrane that holds the small intestines and protects them, and also attaches them into the posterior wall of the abdomen. And hopefully it prevents them their entangling as these intestines are moving. Actually, within this peritoneal cavity, which is the inside of this visceral peritoneum, we have a lot of movement within these organs that the body temperature is higher. So the core body temperature is higher than the surface of our body, which is 37 degrees Celsius. So over there might be like 37.5. And that temperature is important because that keeps digestion happening. If we didn't have that higher body temperature, our intestines will move so slowly, food will stay longer than usual, and the food gets spoiled. And then the bacteria will thrive, and then we will have serious infections. But thankfully, because we have that higher temperature, our intestines move efficiently. Now, organs that are inside the peritoneal cavity are called intraperitoneal. And organs that are behind the peritoneum are called retroperitoneal. So that you form two compartments, intraperitoneal compartment and retroperitoneal compartment. In the intraperitoneal compartment, we have most of the organs of the digestive system. And in the retroperitoneal compartment, we have few organs of the digestive system, but we have the organs of the urinary system, and then we have some organs of the reproductive system. And in females, the organs of the reproductive system actually are found outside the intraperitoneal cavity, in the pelvic cavity, and this one can be called extraperitoneal. The purpose of making compartments in general in our body, guys, is to protect organs from infections. Just in case, let's say that someone has a rupture of intestine because someone was stabbed, or maybe had a tumor or an ulcer. And if you have rupture of these organs, of the tract, basically you have leakage of the content into the intraperitoneal cavity, but those chemicals and the bacteria won't go retroperitoneally, and then you protect your kidneys. And similarly, if you have a kidney infection, you don't want that infection to go into your peritoneum, so you protect your digestive system organs. So that's the purpose of the compartments. The mesenteries are folds of the visceral peritoneum over small intestine, loops, and as well to the large intestine. Depending on where it's located is how you call these mesenteries. So the mesenteries of the small intestine are just plainly called mesenteries. But if it's found in the large intestine, especially in transverse colon, you will call it mesocolon. And then attached to the base of the stomach, hanging from the stomach into the anterior abdominal wall, we have an apron-like projection that is called the greater omentum. The greater omentum is filled with fatty tissue, adipose tissue. That adipose tissue helps to protect the small intestines because the small intestines are constantly moving, so they will be rubbing against the anterior part of the internal abdominal cavity, and that will damage our intestines muscles. So in order to protect them, we have this apron-like mesentery that has fat and also keeps our intestines warm, keep them moving. And now we have a lesser mesentery, which is between the liver and the stomach. And it basically helps for the liver and the stomach to stay in place. So here is the mid-sagittal view and the anterior view of the portions of the intra-abdominal organs of the digestive system. In this case, this is with the apron-like greater omentum lift. So now what you can see here in the mid-sagittal view, since this is on the side where you have the liver, well, you will see, of course, the liver here superiorly, and then this part will be the visceral peritoneum that it is protecting the liver, and then here you have the parietal peritoneum. Anything posterior to this parietal peritoneum behind, it will be called retroperitoneal. Like the pancreas is retroperitoneal, part of the duodenum, and part of the small intestine. Well, the duodenum is the small intestine, so this is retroperitoneal. A little part of the large intestine is retroperitoneal. And then we have, not shown in here, but we're supposed to have the kidneys in this area. The kidneys are retroperitoneal. The tube that connects the kidneys to the urinary bladder, the ureters are retroperitoneal too. And then what do we have extraperitoneal? The urinary bladder, the uterus, the fallopian tubes, the ovaries in females, all are extraperitoneal. And then just below this liver, we have the stomach. And then here we have the large intestine, the small intestines. The small intestines are held by these mesenteries. And then here we have, hanging from the stomach, the greater omentum. Now, if you see in this anterior view and you lift the greater omentum, you can see here the transverse colon, in the left side the descending colon. The ascending colon, you cannot see it because they move the loops of intestine, small intestine to the right, but behind this we have the ascending colon, and then here the mesenteries. Look at how blood vessels from the superior mesenteric artery are located in here. And we have branches of the superior mesenteric veins in here. And then this is the sigmoid colon, rectum, and anus. Any questions? Now, if you let the greater omentum to fall, see how it covers most of these small intestines. And then this is the ascending colon. Here we have the appendix. And then you can see the stomach. This is the lesser omentum, this is the greater omentum, and this is the liver, has two lobes, right and left. Under the right we have the gallbladder. And this is the view in a cadaver of all of this. Clinical point, inflammation of the peritoneum is called peritonitis. Typically this ending, itis, means inflammation. So in this case, it's the inflammation of the peritoneum. Why it could happen? Well, it can be due to an infection, internal infection or external infection. What is internal infection? Well, it can be an infection from one of the intestines that goes into the intraperitoneal space and then infects this peritoneal membrane. Or it can be an external infection, meaning like perhaps you have stabbing wound and part of this bacteria from the skin of the abdominal area where you had the stab goes by this blade of this weapon into your intraperitoneal space, and then you develop that infection. So usually can be due to abdominal trauma and involves a bacterial infection. So when someone is lying in a supine position, basically facing up, and then it has an inspection of this area, doctor starts palpating, basically touching with both hands and then asking the patient, do you feel any pain? They go like this. Well, in peritonitis, the muscular wall becomes so rigid because it's protecting. And it's so painful that you have the muscles severely contract. So you have a hard abdominal wall, and then when you touch, when you palpate, you have what is called rebound tenderness. So you will push against the muscles, and then when you release that pressure, the person will feel pain. That's initially. Later, it will be definitely very hard to push because the person will have so much contracted the muscles. And then sometimes the person will be even hunching like this out of so much pain. It has to be treated with surgery, and then you have to give antibiotics. If this is not treated as it's supposed to be, because it's a medical emergency, the person will die. And sometimes even they die in the surgery because the peritonitis is so severe. Now, the blood supply to the abdominal digestive organs comes from the celiac trunk, superior mesenteric, and inferior mesenteric. This is known as splanchnic circulation. So it's a collection of vessels that supply and drain the abdominal digestive organs. And the arteries, of course, are branches of the abdominal aorta. Remember, in the abdominal aorta, you have three branches that goes anteriorly. First, celiac trunk, then superior mesenteric, and then inferior mesenteric. Celiac trunk provides blood supply to the accessory organs like liver, pancreas, and even the spleen, and also the stomach, duodenum. And then superior mesenteric to entire small intestines, jejunum, ileum, and the first half of the large intestine. And then the last half of the large intestine will be supplied by the inferior mesenteric. And then the veins carrying nutrient-rich blood forms the hepatic portal vein that brings the blood into the liver so that the liver processes these nutrients, and then the liver will drain its blood supply into the hepatic veins that drains then into the inferior vena cava, and the inferior vena cava into the right atrium, part of the systemic circulation. Nerve supply comes from ANS, sympathetic and parasympathetic branches. So the sympathetic has a celiac plexus, superior mesenteric plexus, and inferior mesenteric plexus. Now, the parasympathetic comes from vagus nerve, the longest nerve, the cranial nerve that we have. So it starts in the medulla oblongata, goes into the neck, providing innervation to some of these organs that we have here, and then goes into the abdominal thoracic area, providing nerves to the lungs, to the heart, and then goes into the abdominal area, the vagus nerve, into the different organs that innervates, including the stomach, intestines. Vagus means wandering or wanderer, rambler. So it's very long. And now, the third branch of the ANS, so remember we have three branches, sympathetic, parasympathetic, and then the ENS, enteric nervous system. So this one has multiple plexuses that works with the ANS to control the secretions and movement of the alimentary canal, enteric nervous system. Now the walls of the alimentary canal, typically they are the same with few exceptions. So from internal to external, we have an epithelium, which is part of the mucosa. The epithelium, for the most part, is simple columnar with lobed cells, except in our oral cavity and in our esophagus. In our oral cavity, we have a stratified squamous epithelium with and without keratin, depending on where it's located. If it's in the anterior part of our lower and upper arches, where we hold the teeth, and it has to be anterior, we have this keratinized epithelium. And this is to help us to protect our roots of our teeth. When we drink a hot liquid, the first part where it goes, it will be against our gums anteriorly. So it makes sense for us to have keratin there because it's an inert protein, it's a layer of protein that protects the deeper cells of the epithelium. And also we have it in the hard palate, that type of epithelium. Why? Because every time that we are digesting, we are forming a bolus of food, we are pressing the food against the hard palate. So that's why we have this keratinized epithelium. Unfortunately, if you are drinking a very hot liquid and then you are very careless, that liquid can go internally into our floor of our mouth, between the tongue and the floor of our mouth, and there we have a very thin epithelium. It still is a stratified squamous, but that's without keratin, so that's where we hurt most. And then the food from the oral cavity goes into the esophagus, so that's where we have the stratified squamous epithelium without keratin. And the reason why we don't have keratin is because keratin tends to accumulate in certain areas, and you don't want to have that to happen in your esophagus. But you still have to have a strong epithelium, which is several layers, stratified, flat cells, squamous, and epithelium, which means covering. So it's stratified squamous epithelium. Then from the esophagus up to the anal canal, we have simple columnar epithelium with lobed cells that produces mucus to lubricate the alimentary canal. And then this is an epithelium that has a lot of mitosis, so we regenerate these cells over and over as needed. Underneath this epithelium, we have the lamina propria, which is loose connective tissue where these cells attaches. And then underneath, we have the submucosa, which is MALT, mucosa-associated lymphatic tissue. What do we have there? Clusters of lymphocytes to protect us against infections. They don't have specific names unless it's the tonsils or the Peyer's patches. That's where they have a specific name, this lymphoid tissue. But it's MALT, mucosa-associated lymphoid tissue. And then underneath the epithelium, we have muscularis mucosa. So we have, in most of these alimentary tract, two sheets of smooth muscle. The inner sheet is circular. The outer sheet is longitudinal. The circular, when it constricts, it does this. When it contracts, it does this to the layer of, to the lumen, the internal part of the hollow alimentary tract. So when it contracts, it reduces and occludes the canal. But when it relaxes the muscle, the circular layer, it opens it up. And then the longitudinal, what it does is basically shortens the length of the tract, helping to propel foods from proximal areas to distal areas. So that happens from the esophagus up to the anus. Now, in the stomach, we have a third layer, which is oblique. We have a third layer of muscle. And that oblique layer helps for the stomach to move like this, like in a ringing motion, to mix the food. So you can form a paste like a smoothie that we call the chyme. Now, in the submucosa, we have submucosal glands that produces mucus. So we not only have the gloved cells, but we also have submucosal glands that produces a mucus. And then in this area is where we have nerve clusters of ENS, which is called that submucosal plexus or plexus of Auerbach. And then in between the two layers of smooth muscle in the muscularis externa, which is the inner and the outer longitudinal layer, we have the myenteric plexus or plexus of Meissner. This is part of the nervous system that controls the motility, while this one, it controls the secretion. So with this submucosal plexus, your submucosal gland secretes more mucus, and with this myenteric plexus, your intestinal cells, your alimentary tract cells contract and allows the passage of food from proximal areas to distal areas. Now, the last layer of this alimentary tract is the most external layer, is the serosa or adventitia. It is made out of outer connective tissue, and within the peritoneal cavity is called serosa, while in the thoracic cavity is called adventitia. So here is the view of these layers. So this is the epithelium. Again, typically is simple columnar. And you have spars, or in between these cells, we have the gloved cells. And then here we have these glands that secretes mucus. This is the lumen. This is the most internal part. So this is an open space. And then we have here the muscularis mucosa. And then here we have this dense connective tissue, irregular connective tissue. And this is where we have the submucosal plexus. So these are the submucosal glands that helps to lubricate the food as it's passing through this lumen. So this submucosal plexus increases the secretion of mucus and any secretion of these glands. And then we have the muscularis externa, where we have the inner circular layer and the outer longitudinal layer. And then in between, we have nerves of the myenteric plexus, or plexus of Meissner, that helps for these muscles to contract and relax. And then, of course, we have blood vessels, branches, or capillaries that provides blood supply to each of these layers with except of the epithelium. The epithelium doesn't have blood supply of its own. It's a vascular, if you remember. And then this is the serosa or the adventitia, which is also made out of connective tissue and helps to bring these blood vessels and these nerves into this area. Any questions so far of the layers? Now, we have in this muscularis externa, everywhere except in the stomach, circular and longitudinal layer. In the stomach, we have a third layer, which is the oblique layer. So for the regulation of the motility of the alimentary tract is given not only by the nervous system but also by the endocrine system. So in the esophagus, we have a skeletal muscle in the two superior thirds. In the inferior third, we have smooth muscle. And then we have motility in every piece or every segment of the alimentary canal that it is key for transferring the food, includes swallowing, churning, swallowing in the, and actually chewing in the oral cavity, churning in the stomach, peristalsis everywhere, defecation in the large intestine. Now, the ANS has different function, the three branches. The sympathetic system, it is opposite to the parasympathetic system. Sympathetic system decreases motility and decreases blood supply, which decreases secretion. And parasympathetic will have the opposite effect. Increases motility, increases secretion. And the ENS is a branch in between that can be in charge of local reflexes and also interconnect these short reflexes with long reflexes. We will see in the physiology of this system how these two work together. So, another name for these local reflexes are known as short reflexes because it acts only in specific areas. And we have local neurons, part of the ENS. Now, the endocrine system, it consists of some cells within this epithelium of the alimentary canal that can secrete hormones that are autocrine, basically act on the same cells, or paracrine, that can act in the neighboring cells. All of these can stimulate or inhibit motility of the alimentary canal. Any questions? So now let's look at individual portions of the alimentary canal and their anatomy. So the oral cavity, again, is a fancy name for mouth. It is in charge of ingesting, secreting, and giving us chemical and mechanical digestion of the foods that we ingest, and propels this food into the esophagus. It houses two arches of teeth, the upper and the lower arch, or the maxillary and mandibular arches. It houses also the tongue that helps to compress the food and move it toward the different areas of our oral cavity so that we can chew properly. And we have two pairs of salivary glands, major salivary glands. We have thousands of minor salivary glands that they don't have a specific name, but they are important to keep our mouth lubricated. Now, once you start processing the food and you finish that processing the digestion of the food in the oral cavity, the end product is going to be a mass of food that is called the bolus. That bolus is going to be now compressed against the hard palate, and then with relaxation and contraction of the muscles of the palate and the pharynx, we will funnel the food into the pharynx, And then from the pharynx, the food will go into the esophagus. The pharynx has three muscles. It has superior, middle, and inferior constrictors that contract and dilate to pass the food into the esophagus. Now, the lateral walls of the oral cavity, which are known as cheeks, are formed by the buccinator muscle. If you suck up your cheeks, that's the action of the buccinator. And then these cheeks internally are lined by stratified squamous non-keratinized epithelium. Anteriorly, the cheeks end as the lips, and the lips are formed partly by the orbicularis oris muscle. And in this case, we have stratified squamous keratinized epithelium because that is the epithelium of our skin. And then we have in the inferior wall, in our oral cavity, the muscles of the floor of the oral cavity, which will be the mylohyoid muscles, henihyoid muscles. They run like this. Mylohyoid and henihyoid, they run like this. The teeth are protected by connective tissue, and that connective tissue is the gingiva. And internally, the gingiva is made of stratified squamous non-keratinized epithelium. Anteriorly, it is a stratified squamous epithelium with keratin. And then the gingiva, it is connected into the lips by lingual frenulum. We have one medial, we have two laterals in each lip. This lingual frenulum is the one that prevents our lips from overfolding anteriorly. Horses, I don't know how, when they're doing whatever the noise is called, that sometimes they open so much their lips that you can see not only the teeth but also the gingiva so much. Their lingual frenulums are very small. Okay, so then we have this folding of mucosa that is called the labial frenulum. The space specifically between the lips and the cheeks is called vestibule. And then the space between the teeth, where we have the tongue, it is called the oral cavity proper. The roof of our oral cavity, it is the hard palate and the soft palate. Hard palate anteriorly made by the pouting processes of the maxilla and the maxillary processes of the pouting bone. They meet in the midline, they form the intermaxillary suture. Sometimes that doesn't close when baby is born, and this is called cleft palate. It's often accompanied by cleft lip. Surgery can be done really quickly, very easily. Babies, the mitotic capacity of their cells is so quick that repairs really quick. It runs in families, this problem, and sometimes the upper lip can be so affected that it also goes toward the septum of the nasal cavity. Now, why you want to close it? Well, because you have to have separation between oral cavity and nasal cavity, because that's where air goes into the larynx and then into the lungs. You don't want to have food or liquids going into your lungs. Now, Posteriorly, part of the soft palate, we have a hanging of muscle that is called the uvula. And the uvula, it prevents the food from entering into the nasal cavity during swallowing because the soft palate elevates over the nasopharynx, sealing it, preventing the food from going into the nasal cavity. So this is the internal view and medial view of our oral cavity. So here's the hard palate in the roof, which form the floor of the nasal cavity, the hard palate. And then here we have the soft palate. This is the uvula. And this posterior opening, guys, is called the fauces. And then here we have palatine tonsils. Above here, we will have the pharyngeal tonsils, and then at the base of the tongue, we will have the lingual tonsils. And then we have the superior arch of our teeth, maxillary arch, which in adults holds up to 16 teeth. And then here we have the mandibular arch, which holds up to 16 teeth. The last ones will be the third molars, which we know as wisdom tooth. And then here's the vestibule, the space between the lips and the gums or the gingiva. This is the medial lingual frenulum, the superior medial lingual frenulum. Here we will have the lateral at the area where we have the canines, the pointed teeth, the ones that help us to tear. Canines. Show me your canines. Growl. And then covering the floor of our oral cavity is the tongue. This is the oral cavity proper, the space between the teeth. And then here we have the cheeks, which are made by the buccinator muscle. Then we're supposed to have here the inferior lingual frenulum, labial frenulum, lateral frenulum. Lips, part of the orbicularis oris muscle. And then lateral view, here's the vestibule, here are our teeth, the oral cavity proper, the space between the tongue and the hard palate, which is this, and the soft palate. Fauces, the palatine tonsil, and then here we have the lingual tonsil, intrinsic muscles of the tongue. Here are the floor muscles of the tongue, hemihyoid and mylohyoid here. Questions? So the teeth inserts into the alveolar processes of both the maxilla and the mandible. It aids in mastication, which is basically chewing, ingesting food, grinding the food. Depending on which teeth you are considering, teeth type is what is the function. So we have the incisors, which are our front teeth. We have 4 on each arch. The most middle ones will be the central incisors. These are the wider ones. They are like a chisel. Chisels to clipping food. That's the purpose, holding and clipping the food. And then we have the lateral incisors on the sides of the central incisors. These are the ones that erupt the first when we start getting our teeth. So it will be the inferior incisors, the central, the first one. And then we start having our next types. So they're specialized in cutting off pieces of food. Next set to the sides of the incisors will be the canines or cuspids. They have a pointed crown, specialized for ripping and tearing, holding. Next will be the premolars. If you're an adult, if it's a child, they only have molars. We have first and second premolars, and then we have three molars, first, second, and third. So the molars and the premolars, they have a broad crown that helps for chewing And then within these crowns, we have rounded projections are known as cusps. Then you have two types of dentition. The children dentition will be called primary or milk teeth, while in adults is secondary or permanent teeth. So here we have the incisors, central, lateral, and then we have canines. And then behind the canines, we have first premolars, second premolars, if it's an adult, and then behind the second premolar, we have first molars, second molars, and third molars. These molars in general are specialized for chewing because they have broader surface area. Premolars as well for grinding. And then you have roots 2 or 3 in the first and the second and third molars. Third molars, they become impacted sometimes, and then if they are coming at a wrong angle or they're giving you trouble, sometimes they have to be extracted. So our baby teeth, which is the primary, it has up to 20 teeth. We have 4 incisors, 2 canines, and 4 molars. And generally begin to erupt about 6 months, and then they complete in the second year of life. When you start having transition between primary and secondary, this is called mixed dentition. And then the secondary will have an increased number of teeth. So instead of having 2 sets of molar, you have 3 sets of molars, up to 3 sets. And then you have 4 premolars, or 2 sets of molars, premolars, sorry. And then the transition begins usually about 6 years of age. And then by age 12, all of the deciduous teeth typically are gone. And then your wisdom teeth, if they erupt between 17 to 21 years of age. So here is the view of superior and inferior view of this primary and secondary dentition. So here are the central, lateral incisors, canines, first molar, second molar, and their eruption time. So the first one will be the lower central incisors, followed by the lateral incisors. Kids, babies, they look really cute when they do this. They look like little vampires. And then the superior central incisors will be the second, third ones to erupt. Then you will have your upper lateral incisors. Then you have your lower canines, upper canines, and then you will have your molars. And then here are the different eruption times for your, or transition for your adult teeth. For individual tooth, we have layers. The most external is the enamel. Second, dentin. Third will be the pulp. Enamel is the hardest substance in our body, followed by the dentin. The third one will be bone. In the pulp, that's where we have the nerves and blood vessels that provides blood supply to the tissues of our teeth. And then we have internally, in the alveolar process, connecting the root of the teeth, we have the cementum, which is only found in the root of our teeth. Dentin is made by odontoblast throughout the life. The enamel, it is made out of hydroxyapatite crystals. So we would stop here.